And I've never seen anything like this. I've never seen the volume of this for one specific thing. And it's kind of cool, but also terrifying.
It's a very unusual year for us to be trying to celebrate 100 years because it's such a unique opportunity for any organization to have that kind of milestone and to celebrate. And so you want to do it right. At the same time, working through the challenges of the pandemic and taking care of people's healthcare needs was our priority. And it didn't feel quite right to be having a celebration while your community and your state and your country is going through such a difficult time.
This room didn't actually exist before COVID.
This room at Baptist Health Medical Center Little Rock is now home to numerous high-tech machines analyzing for COVID. Getting an analyzer up and running can take up to 9 months.
And I was here from the ground up with it and spent so many nights in this room alone with it, trying to figure out how to get started with it.
And they got started with it in an impressive 3 weeks, even designing their own special plates with a 3D printer to help the process.
These have 1 through 12 on them and A through H, but obviously they're clear, so you can't really see it. So this just fits on top of it. So you can actually see which well you're going into.
This design was shared with other healthcare systems in need. And why is this all important?
So we have to try to remember that each sample, the hundreds of thousands of specimens you see every day, belongs to a person.
Whether these specimens are gathered at a clinic or in a drive-through, a lot happens behind the scenes.
A lot of people think that it's a very simple test. You come in, you get swabbed, and it's done. It's a very complex test. There's a lot of steps to it, a lot of things that have to be done to prepare the sample for actual testing and amplification, and it's not easy. I think probably the thing we go through the most in this room, though, is gloves. You can't speed it up. You can't make mistakes. You have to make sure that everything is precise. There's 96 wells, and you have to do it 96 times, and you have to do it perfect every time.
The same goes for administering COVID vaccines. There's no room for error.
It was a lot of calculation every day, making sure that everything's going to go smoothly. Across the system, we had 3 different vaccines: a Pfizer vaccine, Moderna vaccine, and J&J vaccines. So all of them have different instructions on how to mix them and how to draw them up, different storage and different handling instructions.
Baptist Health System has given over 122,000 vaccines total, and that's equivalent to the population of Conway and North Little Rock combined.
Baptist Health gave vaccines at 8 different hospitals, including Little Rock, and this doesn't include community outreach sites that we were able to offer the vaccines to.
It was interesting to see how many people traveled from neighboring states. We also had a gentleman that flew in from Mexico for his vaccine. We asked him why he came from Mexico, and he just said that it was the vaccine was not easily available there.
Other things not readily available during that time were hospital beds, specifically for non-critical COVID patients.
The state came to us and said, hey, we're worried about the number of beds available. We've looked around, we've talked to some other groups about some beds we can build or could put in place temporarily. What could you do? And Baptist Health stepped up and said, hey, we'll convert this conference room. Again, we in just a matter of weeks, we took a conference room and turned it into 50 medical surge beds. Luckily, in the spring, the numbers started declining and we never had to use these beds as the non-critical COVID beds.
Despite the pandemic, Baptist Health still found time throughout the year to recognize its 100th anniversary. From raising new flags on every hospital campus during record-setting snow in February when COVID cases were surging, to employee celebrations across the system in June when the cases were on the decline.
And that was really as good a celebration as we could have had, in my opinion, to see the people and talk with them and laugh, and just for a moment, you know, because we didn't get to do a lot of laughing, not near as much as we'd like. And to see old friends and people you haven't seen in a year or more, hand out a gift, have a snack, and celebrate was a whole lot of fun.
It was also a great day in June when a delayed news conference was held to recognize the anniversary and present Baptist Health's gift to the state, a new mobile health unit, a unit that has been busy crossing the state providing COVID vaccines.
And then it wasn't 3 weeks later when our cases really just started to skyrocket.
We certainly saw the surge come with a force that we'd never seen before.
The FDA expanded the criteria of who qualified for monoclonal. And what we knew from what was happening in Missouri and what was already starting to happen here was that we were going to run out of hospital space. And so anything we could do to prevent even a single hospitalization suddenly became paramount.
And suddenly, Gilbert Conference Center had a new use, monoclonal infusion.
You know, within a couple of days, we were able to convert that space into a really nice clinic space where we were able to treat large volumes of outpatients with monoclonal.
When the Delta variant rolled around this summer, we certainly saw the patients much sicker than they'd ever been, and it was primarily ICU beds that were needed.
As a whole state, we start to see this crunch of where there are no beds anywhere. Unlike the first wave, the second wave was really riddled with younger people and in some ways sadder stories. I think because we had the vaccine and in a lot of ways it seemed preventable, like this shouldn't be happening.
And so the state reached out about the ability to open some additional beds on the campuses. So each campus responded to that need for the state and opened additional beds across every campus.
From the corporate office to the hospital staff to the nurses at the bedside, it was never a gosh, why us and not again. It was what do we need to do to serve our community, and it was just phenomenal to watch and be a part of.
And we just didn't step up in state. We took out of state transfers when there was no place for them to go.
That tragedy was met with a great deal of heroism and people really stepping up. And even with all the fatigue of the whole pandemic, that people were pulling through and pulling extra shifts, trying to do everything we could to take care of these patients.
The staff was amazing as we began those conversations time and time again about where are the next beds that we're going to utilize to care for these patients.
Got the phone call about creating more beds probably once a week for about 2 or 3 months. So it seemed like every time we thought we had enough, especially critical care beds, the numbers just kept increasing on us with the Delta variant.
I think that we were all probably asked at minimum of 100 times. Honestly, it's what it felt like. It probably was about 5 to 6 times because it really felt like we just opened an area and then we're full all of a sudden. And so then it is, okay, what's the next area?
But it also means when you have a need, like we did during this most recent surge of COVID-19, that you do what you have to do regardless of the cost to take care of people. And that's what we did.
I think in my career, my 30 years at Baptist Health, I've never been more proud of Baptist Health and Baptist Health's response to take care of our communities.
And I'm delighted to recognize Baptist Health. Troy Wells has been so key to my leadership in getting through the pandemic. He's been on my recovery task force, our healthcare task force. I've met with him regularly, and what Baptist Health has done in helping the state of Arkansas get through this is remarkable. So thank you, Baptist Health.
Some wonderful things happened at Baptist Health over the course of the pandemic. Wonderful things related to COVID and wonderful things that had nothing to do with COVID.
One of the many examples that had nothing to do with COVID is Ray Cole from Northwest Arkansas.
That's amazing. It's the first time he's heard it.
It's amazing that Ray Cole is even able to listen to his heart, since just recently he was told his options were hospice or trying Baptist Health.
It was like clouds opening up because I thought I was going to go home and eventually go to hospice and say goodbye.
Instead of goodbyes, he's talking and walking after receiving a HeartMate, a device that Baptist Health introduced to Arkansas in 1999.
It can assist the heart in pumping if the heart is still strong enough, or it can totally take over the left side of the heart.
Dr. Brian Barris is a new cardiac thoracic surgeon at Baptist Health, bringing to Arkansas a minimally invasive way to implant a HeartMate, a technique he invented.
What we have done then is, instead of implanting these pumps through a traditional sternotomy, going from here all the way down and cracking and opening the chest, now going in between the ribs, one here on the left side and one on the right side.
This is unbelievable, and it's only thanks to this guy over here. He's the best, and it's just been remarkable.
What we have seen is that it decreases your length of stay between 30 to 50%, the chance of dying decreases, and the recovery increases from taking up to 6 months to more around 2 months. For me to see that, instead of spending weeks in the ICU and then several weeks or even months in the hospital after the surgery, to see them be able to go home in as little as 4 days, it's incredible.
Incredible could describe this entire year, from celebrating 100 years to stepping up in heroic ways during a pandemic to caring for all patients. Baptist Health's commitment has never wavered.
We've stayed steadfast in our commitment to our community, to our faith-based ministry, and that's been enough reason for us to continue no matter what kind of challenges came our way. And there's been a lot of them, but there's some wonderful moments as well, and it's made it all worth it.
What it did show me is the Baptist Health team will come together for the state of Arkansas, for the patients in the state of Arkansas, and we're going to do whatever we have to do to make it work.
That we are the leading healthcare organization within the state of Arkansas, and that we will rise to whatever the need in the state is.
If we lean on who we are, we continue to focus on our culture and what we're all about, we'll continue to do the great things in the future like we've done in the past 100 years.